Hey everyone, and welcome to another video. I'm Dr. Alicia Says, and I want to talk about some of the options available for you as an unlicensed therapist when it comes to some of the many things that are available in the job field. Now, I know a lot of times when you think about not being licensed, you may think that a lot of doors are closed, and that can be true. However, it is important to be creative and think outside the box when it comes to finding roles and opportunities that are kind of outside of what would traditionally require a license. So, without further ado, let's go ahead and get started. So, one of the available options is that of working as a social services coordinator. This is typically in memory care units and skilled nursing facilities. It can also be in assisted living environments or places that work with older adults or individuals that aren't able to take care of themselves. So, as a social services coordinator, a lot of times it is very focused on case management and also making sure that you are meeting the needs of residents and also assessing and evaluating for any type of mental health challenge or illness. So there is a lot of times a lot of integration and a lot of interaction with family members and also staff at the facility that you're working at. And it can be a great way to even get hours for clinical licensure. So that is one of the available options. Another option is working as a behavioral health technician, and that specifically would be working in a hospital setting. Specifically, like a freestanding behavioral health hospital, where you're working on the floors with the patients and you're providing psychoeducation when it comes to check-in groups and also kind of doing some of those 15-minute checks just to ensure safety and to make sure their needs are being met and they're also in alignment with the treatment goals that they have. So this can be a great fit if you want to get some experience in mental health and working with clients that have a very wide variety of mental health diagnoses to kind of get that skill set of de-escalation, but also that whole process of really just maybe just I would say honing your group therapy skills and your group skills in general. So that can be a really great fit if you're looking for something that's kind of flexible. A lot of times it is shift work, but there are a lot of options when it comes to making your schedule fit your needs. So that's another option of something that doesn't require a license. Another option of that would be a patient advocate. And these are individuals that typically work in hospital settings or other facility settings where they're really tasked with addressing any concerns or questions that patients have. In this role, there's a lot of integration, a lot of interaction, a lot of times with other healthcare professionals and also patients. This can be a great use of social work skills or counseling skills or a background in helping fill their helping sciences. So another great option, especially if you want to work in healthcare but don't necessarily want to do all the gory stuff and are looking for something that's pretty set and also provides benefits and also the a lot of times the structure and the support of working in a hospital or healthcare setting. Another option would be working as a substitute teacher. They're always looking for substitute teachers depending on the district that you're in. It can be a great way if you want to work as a school social worker or a school counselor just to kind of get your foot in the door and find out if working in a school is really for you. This would, it can be really flexible when it comes to making your own schedule and working when you want to work. And it can also be a good supplement to private practice if you're already working in the field in some way. It can be a good way to use your skills within the classroom. And the application process is usually fairly easy. And most school districts are always looking for substitutes because they do have teachers call off and they need people that are able to kind of stand in and do some of those lesson plans and teach the students last minute. So it can be a great option. Another option is working as an intake clinician, and that would be specifically working sometimes in a healthcare environment, like in a hospital setting where you're working in an inpatient psychiatric unit where you're doing some of those intakes. And that typically means assessing patients to make sure that they meet the criteria for hospitalization and that you have their medications correct and that they are able to be safe. So a lot of times in the role of assessment clinician, you're making a determination on whether or not they need to be inpatient or they're safe to discharge home. So that can be a really great way to just hone your clinical skills and grow as a clinician when it comes to just doing those assessments and determining that best course of action depending on their presentation and what they're sharing with you. Another option is that of working in home health or hospice. This is one of the ones I see typically the most, and it's one of the roles that tend to be one of the most flexible because you are able to schedule visits based on your own schedule and you're able to not necessarily be tied down to an office. This is really the opposite of an office job. So you're typically going to facilities, going to homes, you're meeting with patients and providing resources. The reason why this can be really flexible is because you're working on your own schedule and also working with them. So sometimes you can work evenings, weekends, days, but it can be incredibly flexible, especially if you want to have another job or you're already working in the field or you're balancing field placement or some other type of professional aspiration or goal along with working full time. So this would be, I would say, probably one of the most flexible roles you can have is working in home health or hospice specifically. Another option is working as a group facilitator, and this can be in private practice settings, this can be in community mental health settings, and this can also be in virtual settings where individuals are coming to a group around some type of issue or challenge that they're experiencing, or even a support group. So if you are interested in group work and really want to work with groups in general, this can be a really great option to get some of those clinical hours. And if you work in the marriage and family therapy role, a lot of times you can sometimes get relational hours working as a group facilitator if you're doing like family groups or something like that. So it's a great option, especially if you want to get some direct contact hours, but you want something a little bit different than that traditional, one-on-one therapy hour. Another option is that of being a care coordinator, and that is pretty self explanatory as far as just making sure that you're coordinating care and making sure that individuals get connected to the resources and supports they need post discharge. A lot of times, care coordinators are hired by insurance companies, and they're also hired by hospitals to ensure that there's a safe discharge plan and that some of those needs are being addressed. A lot of times, it involves talking to other healthcare professionals, coordinating referrals, and also talking to family members and patients about what a safe discharge plan is and what that looks like when it comes to just ensuring continuity of care and making sure that they have the referrals and resources that they need. So, yeah, these are some of the options available for unlicensed clinicians. Thank you so much for watching, and please be sure to like, comment, and subscribe. What should I talk about next? So, thank you so much for your time and have a great one. I'll catch you in the next video.